PCOS actually stands for polycystic ovarian syndrome. Actually, it's a misnomer. You don't have a lot of cysts on your ovaries. They're not actual cysts, they're what we call antral follicles, which are fluid-filled sacs with actual microscopic eggs in them. What PCOS is a hormonal imbalance between your pituitary gland and your ovaries. Because you do not make enough FSH, follicle-stimulating hormone, you cannot, and there are too many of these little antral follicles, you cannot make one single dominant follicle and then you don't ovulate. In order to be diagnosed with PCOS, you have to meet 2 out of 3 diagnostic criteria. The first one is what I just talked about. You don't ovulate. You miss your periods because you're not ovulating. That means not having a period for more than 45 days. Sometimes people can go 6 months to a year without a period. The second of the 3 criteria is producing too many male hormones, which we can either detect in your blood or you can detect yourself by having signs of high male hormones such as acne, hair growth on the face, and sometimes even some temporal balding. The third of the 3 criteria is actually having an ovary that has a polycystic appearance on an ultrasound, meaning you see lots of little antral follicles on the ultrasound. The first sort of long-term ramification of PCOS is your increased risk of development of type 2 diabetes. The ovary, the enlarged ovary, actually produces insulin-like substances that interfere with your own insulin's effectiveness. This can make you what's known as insulin resistant. There's a medication that I mentioned earlier called metformin that can actually address this problem and help your insulin to work more efficiently and help avoid having type 2 diabetes. Another long-term ramification of having PCOS is that it disrupts how you metabolize your fats, your lipid metabolism, and it predisposes you to having higher levels of cholesterol and higher levels of your triglycerides, which in turn will predispose you to having a higher risk of coronary artery disease later in life. A third complication from PCOS is an increased risk of actually developing endometrial cancer. This becomes a problem if you don't have regular periods. If you're missing more than 3 to 6 months between your periods and you're overweight, you're at much higher risk for developing endometrial cancer regardless of how old you are. What happens is the extra estrogen that's produced by extra adipose or fat cells will actually make your lining get thicker and thicker, and if you're not ovulating and not having a period, it can become so thick that it can become precancerous. So it's really important to at least hormonally induce a period every 3 months to try to avoid your risk of developing endometrial cancer. PCOS is in fact a self-limiting disorder, and as one gets older and actually runs lower on eggs, the PCOS component will resolve. You will start having normal, regular periods, and ovulation will resume.